So, hi everybody. Hi, how you doing? I'm not standing, I'm not running around. I'm just sitting here actually with a leg cramp. I know that a lot of you can identify with that, all right? But this is an MS Views and News program. It is an MS Views Now event. We have a lot of supporters for this event. As you can see behind me, we have Biogen and Genentech. We have, oh, I got to go the other way. There we go. We got the screen in front of me. We have Biogen, Genentech, Sanofi, Genzyme, EMD Serono, and Bristol Myers Squibb. All right. And again, this is a MS Views Now program. Now, at the beginning of December, Dr. Boster was in his role doing this for us. And we had so many questions that we could not get to that night that Dr. Boster agreed that he'll come back on and we'll do this again. And that's where we are tonight. So the numbers are rolling up. We have more and more people coming on. I'm not going to slow it down. It's, we'll just, there's so many questions that we'll be able to, I'm sure, answer a lot that people want to hear. But first, Dr. Boster is going to speak for a few minutes about things that are relative to the current environment. So let's let you take it away. When you're finished, you're going to speak for what, 10 or 15 minutes?
Yeah, sure. I have a couple things I want to say, and then we're going to leave a lot of time for questions too. So,
Sure.
maybe 5-10 minutes.
Okay, so let me let everybody know before you start speaking. For those of you that are online right now, all right, you go to the box on the toolbar that's on your screen, and there's an arrow. And if you click on that arrow, there's a place for you to write in your questions. If you sent us a question online, please do not ask it again because it's going to be confusing, all right? It's very hard for me to keep up with it all. We have over 400 questions. There's no way we can do it all right? But we'll try to get in as many pertinent as we can, and we'll get started here, okay? So if you asked a question already on when you registered, please don't ask the same question. If you have a new question to ask, please type it in and I will get to it, okay? So thank you. I'm going to bow out for a few minutes while you speak, okay? Great.
Thank you.
Take it away.
Howdy, guys. Aaron Boster here, and as always, thank you for learning about MS with me. I am super excited to be back with Stuart Schlossman and MS Views and News for an MS Now event. This is part 2 because we've had so many questions. I would personally like to thank the sponsors that made this available tonight, and I want to thank every one of you that have jumped online, taking time out of your busy evening and the last night of Hanukkah so that we can spend some time upping our game, understanding not just MS, but MS in the context of a global viral pandemic. So for those of you that don't know me, I'm an MS neurologist in sunny Columbus, Ohio. It's not sunny here. There's a lot of snow on the ground and it's freaking cold outside. But this is my hometown, and this is the town where I want to deliver MS care. This is the town where my uncle had MS. This is where I grew up, and it's a profound privilege and honor to get to provide care for families impacted by MS in my hometown. This year managing MS has been different than the last 15 I've been in the game because of this global viral pandemic. And there isn't a clinic visit that goes by where a good portion of that visit surrounds COVID, risk of developing COVID or contracting COVID, risk if you have COVID of severity. And now we add some very exciting new elements about vaccine. There had never been in the history of humanity a coronavirus vaccine, let alone a vaccine to a novel coronavirus, COVID-19. And it is super duper exciting. About a week or two ago, we saw that the American FDA approved the Pfizer vaccine. And today, the Mnra vaccine was approved. Now, these are really creative and amazing vaccines. So that I can be clear, I think they are safe and I want you to take them. I will take them. I will give them to my family. And I think it is absolutely imperative that we understand the reality of these vaccines. There's a lot of hubbub and drama going around that they do crazy things, and that's simply not the case. So I wanted to spend a few minutes and share my own personal opinions. It doesn't make me right. It just makes me really opinionated. And it's driven from my understanding of the clinical science data, what I'm seeing in clinic with my own patients. It breaks down like this. The risk to contract COVID has nothing to do with having MS. It has nothing to do with other comorbid conditions. It has nothing to do with the medicines that you're on. The risk of contracting coronavirus has everything to do with coming in contact with someone who has coronavirus. Now, here in the great state of Ohio, the governor has shut down a good portion of the state. We're not on lockdown, but there's rules in place, and a lot of restaurants are closed, and there's a curfew, etc. And I saw a statistic when I was getting ready to come into work today that the majority of cases are coming out of supermarkets, secondary schools, and primary schools, where there are still groups of people that are gathered. And it speaks to the critical importance of staying out of the fray. We just celebrated Thanksgiving, and it was probably the saddest Thanksgiving in my family. I had to tell my wonderful mother, no, I would not be coming to her house. At first, she was really taken aback, and I explained that I love her, and she's in her early 70s, and God forbid she got COVID. I couldn't visit her in the ICU. And so instead, we did a Zoom call for Thanksgiving, and it's my hope that next year, the entire family can be together. Now, if you contract COVID, then the question becomes, well, how bad is it? How severe is it? And are there risk factors which would increase a given individual's risk to have a more severe version of COVID? And it looks like there are certain risk factors which predispose a given person to have a more severe course of the condition. What are they? Well, being a boy, being older. So it looks like being 50 is a higher risk than being 40, and being 60 is a higher risk than being 50, so age. Comorbid conditions such as cardiovascular conditions, pulmonary conditions, uncontrolled diabetes, for example. Smokers are at very high risk. And I want to remind everyone that in the very beginning in March, we found out in Wuhan that when they looked at men, the men who smoked and got COVID died 14 times more than the men that didn't smoke. And so smoking is a profound risk factor for more severe disease. The question of whether or not MS makes it more severe is answered with a no. It does not appear that having MS in and of itself makes you at a higher risk of having a more severe disease, unless you have very, very advanced MS and you're unable to move your limbs and you're unable to breathe normally, then you may be at increased risk. Then we turn our attention to the medicines, and there's a tremendous discussion about the safety of the medicines and whether one medicine might put you at higher risk than another. And there's a bunch of opinions. Recently, 20-some so-called experts got together, and MS experts, and they made a position statement with the National MS Society. And, you know, they did their very best job of sharing what they understood of the data, but they don't know any better than anybody else, to be honest. And I think that we have to use some common sense here. Now, it does appear that certain MS disease-modifying therapies carry less of a risk. These are medicines like the injections, like the interferon products and glutaramyl acetate. Some of the pills seem to have a low risk, like teriflunomide and even the fumaric esters. It looks like there may be some medicines that slightly increase that risk, things like fingolimod. And then we get into some of the highly effective medicines, the monoclonal antibodies. You even look at some of the pills like Mavenclad, and they may increase the risk, but it's tricky. For example, let's use a drug, alemtuzumab, very, very effective drug, very, very intense immunosuppression, dropping your lymphocyte count. If you just get Lemtrada, alemtuzumab now, you're going to be really immunosuppressed for the next 6 months. But if you had alemtuzumab 4 years ago, then your cell counts have normalized. So it's very hard to give a one-size-fits-all. The most exciting new element to the conversation, however, is this whole discussion of vaccines. And so I want to spend just a few brief minutes explaining to you about these particular RNA vaccines. So first off, vaccine 101. Instead of allowing you to get an infection and hoping that your immune system can quickly mobilize and attack it and kill it, we can prepare your immune system so that it's all ready to kill the virus the moment you actually see it. How do we do that? Well, typically what we do is we take a vaccine and we rip it apart and shred it up in a blender. And so we have a bunch of little pieces of the vaccine. So let me grab this and I'll use this as an example. So pretend this Band-Aid is the vaccine. So we would stick it in a blender and we'd rip it up. And now we have all these little pieces of the vaccine. So let's take a look at this piece. Pieces of the dead virus. And then we inject this into your body, and it's floating around your bloodstream, and the immune system sees this foreign protein, this part of a dead virus, and it builds antibodies and cells against that. And then it builds antibodies and cells against this. And you build an immune response to those dead pieces of the virus. Later, if you come in contact with the actual virus, your immune system is already primed. It already has antibodies and it already has T cells that can jump on the virus and clear it, which is awesome. Now, with these novel coronavirus, this COVID-19, we were unable to isolate the protein. It didn't work. And so some absolutely brilliant minds came up with a solution which is probably going to win a Nobel Prize. Instead of making the protein, they made the blueprint which makes the protein, RNA. So if you guys think back to high school, you got DNA goes to RNA goes to protein. And this virus is an RNA virus. And so the blueprint that it uses is an RNA. And the scientists isolated a strand of RNA, which doesn't code for the whole protein, the whole virus, just one part, this spike. And so these spikes are on the outside of the virus, and they allow the virus to bind to a human cell and then get inside of it. And so when you receive this RNA blueprint through the vaccine, your own body uses the blueprint to make the spike protein. You make a viral protein, not the whole virus, just the spike. And then your immune system can see that viral protein, the spike, and build an arsenal against it. And what we have found is with both the Pfizer and the Mnra vaccine, when you give it and then 3 weeks later give it again, a week after that, you mount a robust response, like 95, 99% effective. It is super awesome. And it is very exciting that here in the state of Ohio, first line workers, so doctors, nurses, respiratory therapists that are on the front lines, that are taking care of patients in COVID wards, and people that are in nursing facilities and at super high risk are currently being vaccinated. And that is a godsend, and I'm super excited about it. Now, with that introduction, Stu, let's jump into the questions, and I can't wait to hear what you guys want to talk about tonight.
Hi, welcome back. Me, right? So that's a good thing. You know, before I get into all these questions, I had a couple of people write in asking what happened to you and I doing our telemed call last week. And I told them we had technological problems, which is true.
The problem is I'm not very good at technology and Zoom, and we owe them that call, and I owe you a way to figure out how to do it properly. So
we're going to do it. We're going to do it the way we're doing tonight. So we're going to wind up just doing it on a GoToWebinar. And since we know how to do this already, and we'll just be able to handle it like that. Okay. All right. So there we go. That answers two of the questions. All right.
All right. We're doing good.
All right. Fabulous. So, you know, we have questions that have to do with COVID. Obviously, we have questions to do with the vaccines. We also have just questions in general about MS. I'm just going to go through a few and we'll see where they actually lay. All right. So the first one is, I've been diagnosed with MS for about a year. I am receiving the Ocrevus infusions twice a year. Just within the past 2 months, my arms and my legs tingle, feeling like they're falling asleep. Is this a symptom of MS, or does it have to do with the medication?
That's a great question, and you bring up an important point that human beings don't experience an attack, or they don't experience a side effect. They experience a symptom. So this person is giving an example. They're numb. They don't know if they're numb because of MS or something else. Now, obviously, I can't answer that question for that person without better understanding the distribution of the numbness, the character of the numbness, the timing of the numbness, the triggers of the numbness, the onset. But this is something that you want to bring to the attention of your neurologist. And you want to say, hey, I've got this numbness going on. They should do an exam. They may need to get an MRI. Bottom line is they can dig in and figure it out. So the take home here is when you have new symptoms, call your neurologist and tell them about it.
Great, thank you. All right, we're going to jiggle back and forth, all right? Is it safe for people with MS to get the vaccine, and how will we know for sure?
So again, I'm going to make a global disclaimer right now for everything I'm about to say tonight. It's just my opinion, right? So I'm not a virologist. I'm not an epidemiologist. I didn't develop the vaccines. I'm a neuroimmunologist. I'm an MS doctor doing my very best job to care for people impacted by MS. So please keep in mind that this is just my opinion, right? So with that said, is the virus vaccine safe? My answer is yes. It appears very safe. How do I know this? Well, first of all, we tested it in tens of thousands of people. So they didn't just make this vaccine and say, give it, they tested it. So when you hear that it's 99% or 95% effective, that's because of clinical data where we gave the vaccine to a bunch of people. Now, before you say, well, wait, that it's too quick. You only need a month to figure that out. And we can say with certainty that in the short term, this is a very, very safe vaccine. It is a dead vaccine. It's not a live virus. It's a piece of a blueprint. And so there's no thought that it may trigger an attack. It's true that we're not going to know everything there is to know, but I want to make a very important point. I'm not very scared of MS. I spend all day kicking MS in the teeth. It's a joy of mine to beat up on the disease. I am scared of the coronavirus, and I can't wait to get a hold of the vaccine personally for my safety and the safety of my family. And I weigh the risk benefit of a potentially fatal infection against this vaccine. I'm picking vaccine 10 times out of 10.
Great. Thank you for that. All right. So obviously, most of the questions that we have concerning the vaccine and medications all rely on Ocrevus. Okay. I mean, that's 90% of these questions that have to do with a medication. It's Ocrevus, but occasionally we have something else like, what do you think that a person that's using Tecfidera, will the vaccine hurt them for taking Tecfidera? Specifically, the person writes, I'd like to know if I can take the vaccine while taking Tecfidera and seizure meds, Keppra, lamotrigine, and topramate.
Yep. So again, I can't answer for you, and you have to talk to your doctor because there may be specifics about your situation that are unique to you. I can tell you that I have no problem having a human taking Tecfidera receive any vaccine. And the way that dimethyl fumarate Tecfidera works doesn't interfere with developing an immune response or developing, a vaccine response. And so I don't have any qualms about that whatsoever. I'm also not bothered by any of the medicines that you mentioned. And so from my standpoint, to make a general comment, fire it up. I have no concerns about you receiving the vaccine.
Great, thank you for that. All right, so is it safe then for people taking any of their MS medications to also take the vaccine?
So I think that there's a lot of caveats and details, Stuart. And I'll give you an example just because a lot of people have asked about B-cell killers. And, it's not just Ocrevus. There are several B-cell killers now. So we have Kesimpta, which was recently FDA approved, which is a B-cell killer, ocrelizumab, Ocrevus, which has been approved since 2017. There are many people with MS that take Rituxan off label. That's a B-cell killer. And there's another one that looks like it just had a positive trial, ufatumumab. My point is this is an entire class of medicine. And the way that these B-cell killers work is they kill B cells. So they knock out your adult B cells for about 6 months or so. And the question becomes, if I give you a vaccine, will it work? Now, I can't answer that question with data about COVID-19 vaccine because we don't have any, but I can answer that as it relates to other vaccines. And so I'm going to borrow a couple different data points to build a timeline for you. And this, again, is just Aaron's opinion of the data. So and it's coming from data on vaccines for influenza, DTaP, MMR, et cetera. All right, so if you receive a B-cell killer today, and then a month later you get vaccinated, it works about 50%. It works, it just works in an attenuated fashion. If you get your B-cell killer and then you wait about 3 months, it works a little bit more, like 50 to 70%. And if you wait until 5 months, in other words, a month prior to your next infusion, we believe it works fully. And so the sweet spot as it relates to B-cell killers, the perfect timing to take the vaccine would be a month before their next infusion. And so there's going to be some people where that works out perfectly for them because the vaccine becomes available for them at that time. But there's going to be other people where it's not perfectly timed. And that's when we have to consider the risk benefit of taking the vaccine now or waiting a month or 2 months. And that's where the discussion comes in.
Right. So thank you for that. Now, only because a lot of people came on since I last said about the questions, I'm going to ask again that if you put a question in online when you registered, to please not type it in on the screen itself, because I've already had to cross out a couple of them that did come in that way, all right? So it will only get confusing. We have a lot of pages of questions and a lot of questions already being, written in online. All right, let's try to do this as smoothly as possible. If a person, excuse me, if a person gets flu-like from the vaccine, could they expect to get a relapse with that as well?
I would not expect someone to receive a vaccine in it to trigger an attack. That's the kind of thing that we worry about more when there's a live attenuated vaccine than with a dead vaccine. Now, I'm not saying it's outside the realm of possibility, and there is definitely a sense that after the vaccine, you might feel flu-like for a couple weeks. We're going to treat that the same way we treat the flu, or we're going to use medicines to control fever and muscle aches, and it's going to pass.
Could taking the vaccine and that flu-like effect be anything similar to those when people were using interferons back in the earlier days of treatment?
Not even similar, it's the same thing. So Stuart, when you have the reason interferons are called interferon is they interfere with viral replication. So interferons were first discovered in the human body to fight viruses. And when you bottle interferon and then you inject it into yourself, you're introducing the thing that your body makes to fight off a virus, the immune response that makes you feel flu-like. And so, yeah, that is exactly what you're going to experience. And so if someone, for example, took a weekly injection of interferon beta 1A and they felt flu-like, that's what we're talking about, or that's the thought when you receive the vaccine.
Woohoo, I feel so good. Now I know what I'm going to expect. Woohoo.
You're like, that's old hat for me.
I remember what it felt like with that Avonex injection, where I had to mix it all up all by myself and inject it into my body with that nice long needle. Yeah. All right. Getting away from COVID for a minute. Person wants to know if it's okay for them to take omega-3.
When my patients ask me about supplements and minerals and vitamins, I always bring up my 3 rules. Rule number 1 is it can't be too expensive. So to my knowledge, omega-3 fatty acids are not very expensive. Number 2, it can't be dangerous. And to my knowledge, omega-3 fatty acids, particularly the amount in the bottle, like the way they recommend taking it, is not dangerous. The third thing is it can't be instead of something that I know works. So for example, if you said, I'm going to stop my DMT and I'm going to take omega-3 fatty acids, I would say that's not a good idea. But if you're going to do it in addition, giddy up. I'm okay with that. Now, there is some data that omega-3 fatty acids may be helpful in MS. And I have a lot of patients that take it, and I personally don't have an issue with that. Last comment is I always want you to share with your doctor all of the things you take, not just the prescriptions, but the vitamins and minerals and supplements, because that's important for them to know.
Great, thank you. All right, next, person wants to know if there are any laboratory tests, and if there are, what are they, that finds MS, in those with MS, that they might find abnormal?
So the most abnormal laboratory test is not in the blood, it's in the spinal fluid. And so if you sample a human who has MS, and you sample their blood with standard tests, the kind that your doctor may order, like a CBC to look at the white count or the liver or the kidneys, that's all just like everybody else. And it's when you look at the spinal fluid that you can see an overly active immune response. So you may have heard of people saying that they had unpaired oligoclonal bands, or OCBs, where they had an elevated IgG index in the spinal fluid. These are abnormalities that are seen in upwards of 90% of people with MS, and they're not seen in the general population.
Okay, cool. A person writes, I'm wondering if there is any difference in one's MS immunology that defines or impacts the type of MS that one has, or as well as the progression.
So there was a paper that came out, it was a review article written by a bunch of Spaniards this week. And it was a really brilliant article, which made a fascinating comment that the pathology, the immunology, the histology of secondary progressive MS and primary progressive MS are the same, and that it's the same disease and it manifests differently outwardly. Like, for example, Stuart and I are both humans, but we look different, right? like we don't look like the same person. And so I really think that the reality is that MS is probably, and this is just my opinion, one condition with multiple different phenotypes, the way that it outwardly appears. Now, some people are going to throw shade at me, and there's an entire camp that says, no, no, no. And I'm in that camp that says, yes, yes, yes. But the bottom line is that's works in progress. And there's a lot of research going on looking at various blood tests and CSF tests and other measures to try to help ferret out where someone is in their disease, how active that disease is, etc.
Thank you. All right, next, let me get to some of these questions that are writing in online real quick. One is, what do you think about the side effects reported today about Bell's palsy?
So Bell's palsy is a situation where the nerve that runs your face misbehaves, and so you have a droopy face. And I'm not making light of that, and I don't want you to have that. And it can interrupt eating and chewing and talking, and it can make your eye exposed and become dry, and it's unsightly. But I will accept a Bell's palsy the rest of my life to not have COVID-19. And me personally, if that's the risk benefit, I'll do it. I'm not trying to make light of Bell's palsy, and I have a lot of patients that have Bell's palsy, and it's really kind of unpleasant. But I've had some patients that have passed away because of COVID-19, and I would much rather have them have Bell's palsy than die.
Great. Not great, but thank you. Another question. I immediately contracted COVID after an Ocrevus infusion. I have PPMS and I'm still suffering. Does MS extend the time of virus recovery?
To my knowledge, no. I've had plenty of patients in our practice who have developed COVID. Some are on ocrelizumab, some are on other medicines, and some have cleared it like it was no big deal, and some of them have succumbed. And so I think there's a lot of variability.
Thank you. So a lot of people are asking questions about age-related things to do with the vaccine. So let's just try to put this all under one umbrella. And a friend of mine called me earlier and he says, hey, great news. My son-in-law's grandmother was the first in Pinellas County to get a vaccine, but she's 94, he says. Why are they giving it to certain age groups, and how are they diagnosing or saying which age groups are coming first or second?
So to my understanding, well, let me back up and say no one in the government called Aaron to ask me my opinion, right? So it's not as if like I had a say in any of this, but what has been decided is that the first wave of people to receive the vaccine are the people that are at the highest risk of a severe infection or at the highest risk of being exposed. So who are they? They're doctors, nurses, respiratory therapists, and hospital personnel that are on the front lines of COVID-19. So, for example, I'm not taking hospital wards. I don't round in a hospital anymore. I'm not a frontline worker. My good friend Barry Singer still does hospital rounds, and today he took a picture of himself getting his first COVID shot, right, which is super awesome. And so it makes a lot of sense that the people that are caring for folks with COVID-19 in the ICU, the step down, and in the wards are getting vaccinated first. The other group of people that are being vaccinated first are people in nursing homes, because 25% of the deaths associated with COVID-19 have been in nursing facilities. And the people in nursing homes tend to be a little older as opposed to being younger. And so really you're looking at two different populations at risk. Now, interesting, a friend of mine, an MS neurologist out in California named Dr. Bieber, he made an interesting comment. He said he thinks that's backwards, because those people, the folks in the nursing home and the docs on the front lines, are probably taking the most precautions. So he made a comment that he would rather vaccinate a bunch of college kids that aren't following the rules, which is in counterpoint to what the government decided to do. But I thought it was a very interesting discussion.
Thank you. Next one. I was diagnosed with MS for the first time last week. I was given IVIG of methylprednisone for 3 days. I believe the lesion caused an upper lip droop, and I keep spanning for words. I don't know that. How long until this resolves, and how do I decide on a DMT?
So at that stage of diagnosis, and some of you that are listening right now, think back to the first week of diagnosis. It is probably fair to say it's kind of a scary time, because You're still learning about the condition. You're learning about how you have the condition, unique for you. And you're still probably not clear on the logistics, the operational mechanisms by which we're going to treat your disease. You may not even be clear on how to interact with your team yet. And so it's a very, very early time. I tell people when I meet them and diagnose them that it takes on average 2 years to become comfortable with your own disease. Stuart, I'll use you as an example. You are an expert MS patient. You are someone surviving and thriving despite having MS. And let's be very honest, you're extremely knowledgeable. I mean, you know a lot about your disease. You do a heck of a good job identifying symptoms and communicating with your doctors. I mean, you're an expert patient. And this person that wrote in, it's going to be years before they approach your savvy. But you've had this disease for several years now. What do I tell this person? I want to tell them that between now and 2 years from now, they're going to hear, see, read, think things, and they're not going to know whether it's real. You know, they're going to tell someone they have MS at church, and they'll say, oh, my cousin's friend has a dog, and the dog got MS, and they exploded. And you're not going to know whether that story is relevant to you or not. And so what I always tell people is, let me be the translator. Bring me the information. If you read something, bring it to me and let me translate it. And slowly over the course of months and years, you won't need me to do that anymore. It's a very early time. And this is a marathon, not a sprint.
Well, thank you for all the kudos and for responding to that question. All right. All right. Gluten in your diet, does that affect MS in any way? And does diet really make a difference to disease progression or relapses?
It's a great question. Now, if you are really, really bored post-COVID when you're allowed to go to the mall, I would encourage you to walk into a bookstore and announce that you have MS, because some very excited person will say, oh, come with me, and they'll take you over to a shelf where there's a bunch of books written about diets and MS. Some of them are written by people that have initials after their name like me, and some of them make claims that they can do magical things, which is false. There's no diet on earth that I'm aware of which proves that you can slow disease progression of MS. Right? That's a fact in 2020. However, diet is actually very, very important. It is important. And it's my belief that through diet and exercise, you can actually ameliorate symptoms big time. Diet does matter to me. My opinion is that if you can avoid fake foods, fast food is not real food, fried foods, heavily processed foods, foods that are very high in salt, foods that are very high in sugar, these are foods that you want to avoid. And if you have a food and it has ingredients that you can't pronounce, that's not food, that's a chemical. And if you instead abide by a whole food, real food diet, time and time again, I've seen it miraculously change patients' lives. Not only do they lose weight and feel better, they have more energy, they sleep better, they have less ataxia, sometimes they have less numbness. It's really, really cool to see. Now, specifically as it relates to gluten, here's the deal. We don't know. Why don't I challenge you to not eat gluten for 3 months or 1 month, and then you tell me whether it makes you feel better. I have some patients where we've tested them, they don't have celiac sprue, they're not gluten insensitive, but when they avoid gluten, they feel better.
All right, cool. All right, so next thing, short answer, please. Can a person with MS take a shingles vaccine?
Yes.
Thank you. Tell them why.
So you don't want to have shingles, and there are MS medicines that suppress your immune response, which can increase the risk of shingles. Now, shingles on your flank hurts like the dickens. Shingles in your eye can make you go blind.
Great. Okay.
It's a dead vaccine.
But they should have the dead vaccine. Right. All right. Do any disease-modifying therapies take size of a person into account, or does that matter?
No, they don't, and yes, it does. So
if a person is 300 pounds, how do they get the same? Why would they get the same dosage as a person that's 120? So
there are. I'm going to use the B cell killers as an example. Okay. So the B cell killers, let's use ocrelizumab as our example. ocrelizumab is a flat dose, and it's given at a set time. And it turns out that if you're a big human being, that it kind of wears off sooner. And if you're a tiny human being, it lasts longer. And so a rational man's approach would be based on that to change how you dose. Now, we're not there yet, and we haven't been able to dial that in. But weight does matter, and it's not factored into the clinical trials. In the clinical trials, they come up with a standard dose that pretty much works for everyone, more or less. I have some patients, for example, that take ocrelizumab, and at month 5 or at month 4.5, I have to give them steroids, not because they're having an attack, but because old symptoms are coming back out, and we have to quell them before they're ready for their next infusion. I've tried on a couple occasions to tighten the infusions closer than 24 weeks, which is off-label, and insurance says no, but insurance is wrong.
All right, thank you. Next, I have a non-aggressive form of MS. I haven't had a relapse in over 2 years, but I am currently not taking any MS medication. Is it a good idea to start Ocrevus for the first time while COVID-19 is still on the rise? Short answer.
Yes, do it right now.
Thank you. All right, next. Is there anything new for older, debilitated people that are primary progressive, other than maybe they don't know what's out there right now? I have no clue.
So primary progressive MS has one FDA-approved therapy, and that's ocrelizumab, the drug that we were talking about earlier. And there's an interesting paper that came out very recently, actually 2 that I'll talk about. But what the take home is that people with PPMS or SPMS, they can progress, and taking ocrelizumab or a B-cell killer can maintain hand function and maintain cognition. And so if you're seated in a chair and your legs don't work anymore, I bet you really like your arms. I bet your arms are like your favorite limbs because they're your arms and your legs. And I bet you like thinking. And so taking ocrelizumab has been demonstrated to maintain those functions, which I think is really important. There's a bunch of other things that are in the pipeline. Right now, we're studying a compound called BTK inhibitor, and this BTK inhibitor is being tested in PPMS. We're very excited about it, but it's in phase 3, and so it's not prime time just yet.
Okay, thank you. Person writes, some people with MS have said that it uses T cells to attack the coronavirus. T cells attack MS. MS meds attempt to eradicate T cells, B cells too. So what's will it activate the MS?
So that is a profoundly overly simplistic view of the immune system, which gets you into trouble. And then the reality is there's like a bunch of T cells and there's a bunch of B cells, and they're not all involved in the vaccine, and they're not all involved in MS, and they're not all involved with coronavirus. It's actually way more complex than that. So we have to call that out. Now, I'll give you an example. When you take the Mnra vaccine or the Pfizer vaccine for COVID-19, there is a gigantic T cell response. So your T cell response is really, really big. And if you're on a B cell killer, I'm really glad to know that you have a robust T cell response. MS medicines are complex, but as we talked about earlier in this discussion, it doesn't mean that you're not vaccine ready.
Okay, now that you brought up the word vaccine, now I'm going to ask you some specifically related questions to vaccine. All right.
Okay.
First one being, does the vaccine activate the part of the immune system that causes relapse?
No.
Okay. Is the vaccine safe if you've had allergic reactions to other medications?
We don't know the answer, but probably safe, because this is not like any medicine you've ever received.
So the people that were recently diagnosed, well, the people that it said recently that the frontline worker in Alaska was said to have had an allergic reaction because of having had allergic reactions in the past to medications. How do they know which are and which aren't causing that?
We are watching science as it unfolds. We are watching medicine in action, and it's really, really hard to watch. We can look back at the measles pandemic and we can say global statements with authority because we know this is happening in real time. And the American population is probably watching science closer than they ever have in their lives, and it's complex to watch. Is it okay that somebody had a bad allergic reaction? No, that's not okay. Does that mean that we should all shy away from the virus vaccine? No, it does not mean that.
So those that had anaphylactic shock due to, say, when they used one of the MS medications or any other medication, should they be alarmed to having this or not?
I think that's such a specific situation that we have to take it to their doctor and ask the specifics of what's going on with them. You know, just because you have an allergic reaction or an anaphylactic reaction to one medicine does not mean you're going to have it to another one. And there are ways of giving someone a scary medicine in a safe manner.
And that is how?
Well, so for example, when I was in training, we had a person that needed a particular antibiotic. It was the only antibiotic that this infection they had would respond to, except they had anaphylaxis. So we admitted them in the hospital, and under extreme supervision, we increased the dose a little bit each day until they acclimated or tolerated the antibiotic, and we were able to treat them, and they were fixed. And so that's not just, you know, easy breezy cover girl. It was something that took a lot of effort, but we were able to do it.
Right, thank you. Is the vaccine safe to take regardless of the type of MS one has? And is it safe to take in the middle of a flare-up?
We don't know the answer to that. I don't imagine that it would be less or more safe with one type of MS versus another. And as far as taking it during a flare-up, I might not give you the vaccine during a flare-up for a different reason, because I'm giving you steroids and I'm trying to ameliorate your response. I might wait until after the flare-up has been treated and calmed down, not because I'm scared to give you the vaccine, just because I don't want to cloud the picture so that we're not clinically confused if you have a new symptom.
Okay, so I forgot what I was going to go to with your answer, but I'll get back to that hopefully in a little bit. For now, I've had only one full-blown exacerbation. That came shortly after I had my first and only flu shot ever. So I'm afraid now that if I take the COVID vaccine, will this cause another exacerbation? What are the risks for the MS patients? I know some of the questions in the past was similar to this, but this one was a little bit different.
It's relevant, Stu. The answer is we don't know. To my knowledge, they did not test these vaccines with subgroup populations that have MS. So it's not like we took like 20,000 people and 10,000 had multiple sclerosis. And so we don't, just like we didn't test this vaccine in a bunch of people that had diabetes necessarily. We were testing it in the general population. And so we don't know. But what we do know is that there's been 300,000 deaths. 300,000 deaths since March because of COVID. That's more deaths than all of Vietnam, all of World War II, all of World War I. Every war that the United States has been in has had less deaths than we've seen in 9 months from this virus. And so, yes, it's reasonable to wonder what's going to happen, but I don't need to wonder what's going to happen if we don't take the vaccine.
So my question to that is, they say that that the Pfizer is 95%, right? And if I get vaccinated, how will I know that I am not of the 5%?
So it's going to be the same kind of phenomenon that you have when you take a flu shot. Now, the flu shot, most people don't know, the flu shot's like 50 to 70% effective at the best. And so you may take, I've taken the flu shot every year since I've been in med school. I'm required to. And I've had the flu as a doc, you know, despite taking the flu shot, because it's not perfect. Now, we can test antibodies against COVID-19. So there are commercially available antibody tests, the blood test, which will tell you if you mount an immunity. Let me give you a quick scenario. Someone hypothetically gets a B cell killer, and then a month later, the vaccine becomes available and they take it. Question is it's only gonna be about 50% effective. Then we fast forward 5 months, a month before their next infusion. Maybe we check antibodies for COVID, and if they don't mount a big antibody response, we give them a booster to boost them up before their next infusion. That might be a very good way of mitigating this risk.
Okay, so do we know though, thank you for that answer. Do we know if there were any people in the trials for either the Moderna or the Pfizer that were autoimmune of any type?
I don't know, but I don't think so. I'm not sure about that, and there may be some people that are actually listening in that know better than I do. But to my knowledge, no, they didn't test it in folks that have autoimmune conditions.
Okay. Now, Fauci came out, and this is not MS related, but I'm sure a lot of people know people with Guillain-Barré. And Fauci came out with the other day that, yes, everybody that has an immune response of anything negative, that they should be taking the vaccines. All right. But he did say that anybody with Guillain-Barré should not be taking it. And so I would like to know why.
So sometimes when you take a vaccine, you can trigger a weird immune response. And there are some vaccines where you can trigger Guillain-Barré. So Guillain-Barré, for those of you that are not familiar, is a demyelination of the peripheral nerves. So MS is demyelination of the brain and spinal cord, right? Guillain-Barré is not MS. Guillain-Barré is demyelination in the peripheral nerves, the nerves in your arms and your legs. And there has been cases where you give someone a vaccine and they develop Guillain-Barré. But I want to highlight that that's exceedingly rare. It's super, super rare. And we don't want to throw the baby out with the bathwater. So what Dr. Fauci is probably saying is, here's a very small population of people that might have an increased risk, so be careful of that.
Sure. And the only reason why I brought this up, everybody, is my dad suffered from Guillain-Barré back in the early 90s. It has cost him a lot of problems over the years. And, you know, now with this being said, so he heard about it and he says, I'm definitely not, because his was caused by a flu shot. So,
yep.
So, yeah, so that would be the reason. All right. So going forward, we have tons of questions. We're going to get on to the next one. I'm taking Ocrevus. How about that? And I have low oxygen saturation, 81% per sleep study. I use supplemental 02 at night, and I've been sheltering in place since March 9th. Is it the right thing? 02 or O2, sorry, is now sitting up at 81% to 83%. Is this a problem or wrong pulse oximeter reading? Ugh.
So the question is a little bit confusing. Of course, I can't give you like medical information over the interwebs, particularly when I only have that piece of information. I think what I'm hearing is that the person has obstructive sleep apnea and at night their SATs drop and they're on supplemental oxygen. Or maybe they have COPD and they're on supplemental oxygen. So is it a good idea to take oxygen? Yes. Would that person be at increased risk of a more severe COVID infection? Probably. Should they hide at home? Yes.
Great. Not great, again, but great answer. Lately, I've seen articles regarding age and DMTs, which suggest that people over 60, I'm in trouble, should stop taking a medication. No, I'm not. Seriously, I'm not. Now I'll let the doctor respond.
So am I allowed to say bullshit while we're talking, Stu, or is that not allowed?
If you'd like, only if I can sniffle.
Okay, so that's bullshit. And I apologize for my foul language, but it really makes me very angry. I think it's completely inappropriate for MS neurologists to be ageist and to say, and Stu, I'll use you as an example. Say, hey, you had a good run of it. You've done really well on your medicine. So now we can take you off. And if you progress, that's okay. That's not okay with me. There was a study done where they looked at people that were like 55 who had not had any disease activity for a certain number of years. And they took half of them off their DMT and left the other half on. And what they concluded was it's okay to stop your DMT because only a third of the people off DMT progressed in their disability. Well, excuse me, if that third is my sister or my mom, I'm not okay with that. And so maybe the reason that you're doing so well is because you're on a DMT. Now, we don't say, hey, look, you know, you've done really well. You haven't had a heart attack and you're now 60. So go ahead and stop your aspirin, stop your beta blocker, stop your medicines and go ahead and have a heart attack because you had a good run of it. Absolutely not. I think that is nonsensical.
Right. And just so people know, also, years ago, I had an insurance company that wanted me to stop taking my MS medication because I had not had a relapse in several years. Yeah, exactly. And I told them, but if I come off and I have a relapse, it'll cost you more than if you just continue paying for the medication. So, anyway, I had to fight it, and of course I'm still on it, and I will fight it and always remain on it. So that's how we go forward. All right,
I
next.
also just share really, I'm sorry, I'll share really quickly, Stuart, that I have several patients that were taken off DMT by other doctors, and I've watched them progress. And they're in their 60s, some of them are in their 70s. We've put them back on therapy. Guess what happens? They stop progressing. Magic.
Imagine that. Imagine that. We could go around talking about that all day, right?
Yeah,
Okay.
yeah, we could.
All right. D would like to know if you had a choice between Pfizer or Moderna, which one should you take?
I have an answer. Whichever one you can get first.
Right? It's amazing. All right. Now, just so another one that was brought up, I heard that Johnson is doing a study, and I don't know what phase they're in on their vaccine, but theirs is only one shot. Why is that?
I don't know. And when I say I don't know, I actually don't know anything about the vaccine development program for them. So I really am not in a position to answer. What I can say, though, is that the number of doses is based on science. So, for example, with the Pfizer and the Moderna vaccine, they didn't just pick that randomly. What they found was if they give it once, then you mount a certain amount of immunity. But if you give it again, it skyrockets. And so that was developed because of the science told them that. And so at least theoretically, this other vaccine that we're talking about doesn't require that. There's a lot of vaccines that require a two-step, like the shingles vaccines that we talked about earlier in this talk, like the hepatitis vaccines. There's many of them that require a stepwise, so that's not really uncommon.
Okay, so person writes, the fungolimod in COVID-19 trial in China was withdrawn. Do you know why, and was it there any preliminary data that may have come out that you know about?
No, China has not contacted me. I'm not aware of what they did. Jokes aside, I have not seen anything in the published literature. I read about MS every morning when I wake up, and I haven't seen anything about that.
Okay, for the many that have come on, maybe late, maybe they missed what you said earlier, is there any disadvantage to take Ocrevus during COVID-19?
There's a big discussion about whether or not B-cell killers increase the risk of a more severe infection. And I don't think we know the answer. I want us all to behave as if it does, because that's going to make sure that we are the most safe and that we take the most precautions. However, in my heart of hearts, I think that the comorbid risk factors, the risk factors that I mentioned earlier, advanced age, meaning 50 more than 40 and 60 more than 50 and 70 more than 60, being a man, being morbidly obese, having uncontrolled cardiovascular conditions or pulmonary conditions or smoking cigarettes, these are the biggest risk factors. So I don't view taking an MS-DMT, including a B-cell killer, as the most important risk factor. I think that we have to consider the human being as a whole. And I can share with you that I've stopped or held or limited very, very few people from receiving their Ocrevus.
Okay, good. So this is a good question that I'm about to read. It's definitely not a repeat. It's from Yolanda. And Yolanda, thank you for writing this. Is it true that once we take the COVID-19 vaccine, that we will still have to wear masks and practice social distancing?
Yeah, I think that's absolutely true. So if you think about why, we don't know whether or not it fully took. Remember I said it's only 95%? So what if you're the 5%? Well, if you wear a mask, you protect everyone. Moreover, it's very important that everyone in the population wear a mask. And if some people aren't wearing a mask and some people are, and you say, well, no, I don't need it because I've been vaccinated, I think that creates a very, very confusing situation. I will continue to wear a mask in public for a very, very long time.
So when is the general public going to be told all about this? Because there are so many out there that were just saying that they can't wait to take this vaccine so they can't stand wearing this mask anymore. And when will the CDC be giving them this information as well? I know they didn't ask Aaron about this.
Yeah, I'm not sure, but I mean, I think that we need to realize that just because some of us are starting to receive vaccines, this is not over, and this is not going to be over in a year. This is going to take a really, really long time. If we are remotely successful immunizing the entire population of the United States, that's going to be a year or 2 years to do that successfully. And this whole time we may be at risk. And so I want you guys to buckle up, and I want you to prepare yourselves for a long, not a short, but a long stay.
Right, right. So again, let me interrupt for a minute. There's a lot more people that have even come in since the last time I said that a lot more people came on. And I'm going to ask again that if you had registered and you input a question when you registered, we're asking that you don't repeat it. But the problem is, if you just came on, I may have already asked you a question. So I don't know what to say about that, because if I see your question being said again, I might skip over it, knowing that we've already spoken about it, okay? So, and I apologize for that, but that's why we have time zones, okay? All right, question, and this is sort of where it's been asked already, but not quite, but Joy is asking, will people with MS have a flare-up from the vaccine? And I know you answered it in some degree earlier, but you know, it's there again. So we'll probably answer that for 90% of online right now.
To the best of my knowledge, I don't anticipate that this dead RNA vaccine will trigger an attack. It remains to be seen because we didn't test it in a population of folks with MS, but scientifically or medically, I don't think it'll do that.
Okay, thank you for that. All right, next one is, what lifestyle factors, habits are important for individuals with MS to consider modifying to better support their immune systems and the disease process in the context or in the time of COVID-19?
So I want everyone with MS to be 4 for 4 in their fight against MS. I want you to be 4 for 4 because I know about 4 things that slow down MS, and I want you to do all 4 of them all the time. Number 1, don't smoke things. So smoking things can speed up MS by almost 50%, and quitting smoking things can slow it back down. That's number 1. Number 2, exercise is part of your lifestyle. People with MS who exercise as part of their lifestyle develop less disability as they age compared to those that don't. And I could go on for a long time about the profound benefits of exercise to energy, to sleep, to cognition. It's really important. Number 3 is, after we talk about the first, the second, the third is vitamin D. And so low levels of vitamin D drive the disease faster, and levels above 50 slow it down. And so supplementing vitamin D with D3 is a very, very helpful thing, in my opinion. Number 4 is to take a disease-modifying therapy and make sure it's working. I'm going to add a 5th one in general, but specifically for as it relates to COVID-19, and that's practicing mindfulness or practicing mental health exercises on a daily basis. Because it's not just a global viral pandemic, Stuart, it's a global mental health crisis that we're dealing with. We are more alone. We feel more socially isolated. There's a higher incidence of depression and anxiety than I've ever seen in my entire career. And taking a moment each day to be in the moment, to be present, to be calm, to meditate, to think is really important. I'll give you a quick example. I spend most every night sitting out by my fire outside, relaxing and just watching the fire. It's a meditative thing that I do almost every evening. And it's really important to me.
Thank you. Interesting question. If a person has MS and they have a few people with MS in their family, is it possible that a vaccine can trigger MS in a person that currently is not diagnosed with MS?
Not to my knowledge.
Good answer. Next, did you say, or let me go to this one here. Where is the data supporting MS persons during these trials? I think you answered that already when I asked, but I'm not sure.
So we didn't test this vaccine in all kinds of different subpopulations. We tested it in a big chunk of people with tens of thousands of people, and it appears to be safe. It is a modern medical miracle that we were able to construct such a vaccine in such a short period of time. And we probably don't have subgroup data about different types of disease states. That being said, we know it's highly effective and it appears to be safe, at least in the short term that we've studied it. And I, for one, am very pro-vaccine, and I will take this vaccine. I will give it to my family, and I encourage everyone listening to me to take it as well.
Okay. Charlene writes, what vaccines are live and which are Mnra?
So there's a bunch of different kinds of vaccines. For example, there's a dead shingles vaccine and a live attenuated shingles vaccine. There's different lists, and I'm going to avoid going through them all. One vaccine that's a live vaccine, which is best known to trigger an attack, is the yellow fever vaccine. Now, most red-blooded Americans never need to get the yellow fever vaccine unless you travel to an area which has endemic yellow fever, like western part of the continent of Africa, for example. Which vaccines are mRNA vaccines? None. This is a brand new way of delivering vaccines. So the Moderna and the Pfizer vaccines are the first two to bring this extremely exciting and provocative scientific breakthrough forward.
Okay, thank you. A person wants to know if, and I'm going to screw up the name of this, but Clovir, ACYCLOVIR, off-label. She's taken for something. Would that help in the fight against shingles?
So acyclovir is the medicine that she's referencing, and acyclovir treats shingles. So yes.
Okay. Another person's writing right now. We got a lot of Jills on here, but this is a different Jill. This one's Jill S, just to say it. I remember your leaky pool analogy for MS. I'm wondering if MS always progresses eventually, regardless of DMTs, or can it stay as it is? I'm 2 years in diagnosis. Sorry about that. I'm 2 years in diagnosis on Gilenya, and are any chances, though, if it's still worsening?
So the leaky pool model for MS was invented by a friend of mine named Dr. Stephen Krieger in Mount Sinai. I love his model. I talk about it a lot. I did not invent it. I just think it's brilliant, and I use it in my clinical practice to teach patients and families. Is it a guaranteed that you're going to progress in your disability? It depends on where you're looking and what you're looking at. The majority of people over a period of 30, 40 years are going to have some progression of disability. It could be very, very minor. It's the rare patient that has nothing over the course of their entire lifetime. But it is also not a foregone conclusion that you're going to end up neurologically disabled. And in the modern era, with the early application of treatment, the outcome looks brighter than it ever has.
Okay, thank you. You were breaking up a little bit. I hope everybody was able to still hear what you were saying, but you were coming in a major abstract, like you were on Star Trek and getting ready to be beamed up. Okay. All right. Next, is there any information about how the COVID therapies might interact with the different DMTs currently available? And could there be any contraindications?
So I think it's contraindicated to take certain vaccines at certain times. So for example, if you give someone a lymphoablative therapy like alemtuzumab, I wouldn't give them a COVID vaccine the next month, right? But again, it's specific for each individual human, and it's going to be different for each individual DMT. There is no science to guide us. The National Med Society gathered a group of 20-some MS neurologists, and they gave their opinion in a position statement. Again, it's just their opinion.
Okay, thank you. There's a lot of people on here, and there are people asking questions about them having their immune systems boosted. Going back to MS 101, I just have to say this because Dr. Boster let you all know how I'm an MS expert, all right? Here's the bottom line. You have MS. You already have an increased immune system. You don't have a depleting immune system. You are not HIV, all right, or anything like that, all right? So you just got to watch and, not be taking all these synthetics to boost your immune system when that could cause you a great amount of harm, not good. Am I right?
100%. So
Great.
you're not suppressed. You have an overly active immune response, and I don't want to do anything to boost it.
Correct. So if again, people want to know how the vaccine actually works. I mean, what is it that they're looking for? How is it that they'll even know that it's working for them, other than to say that they might never get sick?
So it's the absence of an event which proves the success. For example, if you take an oral birth control pill, how do you know it works? Well, because you have intercourse and you don't get pregnant. And so that's how you know it works. If you're taking the disease-modifying therapy for MS, how do you know if it works? Because you don't have an attack and you don't progress in your disability and you don't have new spots on your MRI. If you take a vaccine against varicella, how do you know if it works? Because you don't have shingles. It's the absence of an event that helps you understand success. Right now, people are dying from COVID-19, and the vaccine is going to protect and save hundreds of thousands of American lives. That's awesome.
Thank you. Next one, and this is a different question too. Thank you, Maureen, for sending this in. Is having an LDL cholesterol level over 80 considered uncontrolled cardiovascular condition for risk of COVID, say around 115?
I don't think so. So that doesn't sound super duper high to me. Now, should you have your cholesterol treated? Probably. Is that an insanely high cholesterol? Not to my eyes.
Okay, thank you for that. And here's another good question from another Jill. All right, and we'll just keep it at that. And asking about masks to be worn while getting an MRI. Is it allowed?
I don't know. The MRI machine that we use does not require people to wear a mask inside of it. Now, mind you, they're in a tube and they have a cage on their face, right. But they don't wear masks when they get it done. The MRI machine is sanitized and cleaned down in between because people are clearly sitting there for 3 hours breathing. But I think you can sanitize the machine afterwards.
Yeah, somebody called me the other day and told me that he's getting ready to go for an MRI and what I would suggest that he do. And I said, bring a lot of sanitizer with you. And if you don't trust what they did, then you spray or you wipe everything down with your Lysol or Clorox wipes or your sanitizer spray bottles and just give the whole area a bath and you'll feel better about it.
Yep.
That's all, right?
Yep.
Okay, so, all right, so another one, most masks aren't big enough. They end up under the nose and under the chin or as a chin strap. What do you suggest for people doing that?
Wear your mask properly. So the whole point here is that if I breathe and talk, there's respiratory droplets that come out 6 to 8 feet everywhere. And so it can get inside the mucosa of your eye, it can get in your nose, it can get in your mouth. And so ideally you want to protect all of those things. So if you wear a mask here, you're covering your nose and your mouth. If you wear a mask here, you're not helping anything. Keep in mind, the number one reason you wear a mask is so that your respiratory droplets are prevented from spraying. And if you're wearing a mask like this, as you breathe out of your nose, you're defeating the purpose. So you want to wear a mask that fits your face. And if the particular mask that you got doesn't fit because you have a particularly long face, wear 2 masks or buy a different mask or wear a scarf around your face.
Now, let's go back to that a minute now. Now let's talk about going with the masks. Is it safe for a person to be wearing a 1-ply piece of fabric where, again, if they could breathe through it, why are they wearing it? And if they could breathe through it or blow through it and blow out that candle, that means that they're inhaling also whatever's out there. Yay or nay?
Yay. I think that you're bringing up a very good point. We've now had enough time that there's a plethora of masks to choose from.
That's right.
And I saw a very interesting article yesterday, which was commenting on some efforts to look at which masks are better than others, because we're going to learn some masks work better than others. So if you have t-shirt material covering your face, you're probably not preventing a lot of stuff from going out and a lot of stuff coming in.
Okay. Getting off topic from COVID for a second, let's go to medical cannabis. The benefits of using medical cannabis help what for an MS patient?
The science is lacking. And so if you go to the science, it really leaves a lot to be desired. Anecdotally, as a medical marijuana recommender in the state of Ohio, I have come to believe that there are 4 major things that medical cannabis seems to help my patients with. Number 1, insomnia, which is not a small matter, actually. Number 2, irritability. Number 3, neuropathic pain. And number 4, the most common and the most effective I find is for treating spasticity. Those are the 4 things that I most commonly hear are benefits. Now, I have heard other things, but much less common. I've had 2 patients that swear it's helped with erectile function, but that's 2 out of a bunch, and I haven't heard that routinely.
Okay, thank you. All right, next we have different people would like to know if the vaccine is actually going to them at that temperature of negative 100 and plus, and how
No.
is that? Okay, so
So
what is
real
it
quick-
that they're getting?
So real quick, RNA is not stable at room temperature for very long. So if you have RNA for more than like 6 hours, it's going to dissolve. So when you make the vaccine, you're making this RNA blueprint. You have to get it at negative 80 to transport it, or at least for the Pfizer vaccine you do. And then they thaw it, and then they need to use it within a certain amount of time, within I think a couple days so you're not receiving a freezing vaccine. They're thawing it and getting it ready and then giving it to you at room temperature.
Okay, thank you. Now a person asks if there's a microchip in the vaccine.
No. Now, 2 things. Number 1, no. Number 2, every single one of you are tracked on your phones. Your phones
Right.
listen to everything you say and record it, and they know where you are at all times. So I think it's hilarious that people are concerned about a microchip in a vaccine when they carry a microchip with them at all times.
Correct. All right, going back for the many people that are asking the questions about should they be using their medications while COVID is around? Will they get any effect from it, regardless of which medication it is? We could list them all, but there's 20-something medications. So you tell me.
Let me make a general statement. We will not be in a global viral pandemic forever. There will be a point in time, hopefully in a year or 2, when we no longer have a global viral pandemic. And God willing, all of you that are listening with MS will still be around and you'll still have MS. It's not going to go away. I don't want people that I take care of to get neurologically disabled because I held their medicines during the viral pandemic. And then when it's over, my patient is disabled. I'm not okay with that. And it's a hard job, but it's a job that I accept. I need to balance the risk benefit of keeping them safe from COVID while I keep their MS boring. And it's my belief that you can do both.
Great. Okay. CBD. What can you tell us about how CBD might help with nerve pain?
So when you look at the plant marijuana or cannabis, there are a bunch of cannabinoids in it. There's hundreds of these chemicals that are called cannabinoids. And the 2 highest concentrations of cannabinoids are CBD and THC. Now, THC is psychoactive. It binds to CB1 receptors in the brain, and it can make you feel high or weird. CBD binds to CB2 receptors and is not found in the brain and cannot make you high. It cannot make you goofy. It's not a controlled substance in most places in the United States. And it does bind to a lot of different parts of the body, including immune cells, actually. And I've had anecdotally people tell me routinely that it helps them with pain. I have patients that find that if they rub it on their calf or their ankle, that it helps tremendously with spasticity, with nerve pain. Not everybody, but plenty of people. And these are patients that are finding they don't need lidocaine cream and Neurontin. I believe them that it's really helping them because they don't need those other medicines, which I think is pretty neat.
Thank you. All right. Person asks, and you might have said this earlier, I don't remember. Did I hear you say that I should take the vaccine a month before I get my Ocrevus infusion if I can?
Yes.
Good. All right. How close can you take the shingles vaccine to a COVID vaccine? It's a good question, Michael. Thank you.
That is a good question, Michael. I don't know the answer. If I was choosing, I would try to separate them because I wouldn't want to create confusion. However, it's probably not necessary. We give lots of vaccines all at the same time. If you've ever taken your kid in for vaccines, they get like a bunch all at once. And it's probably okay to take both at the same time. But given that it's kind of new, if I had the option, I would space them out.
Great.
That's just
so
my.
With all the people, thank you. Sorry. With all the people that are going for testing for COVID, should they, if they don't feel anything that's wrong with themselves, or should they if they know that they might have been exposed by being around people that might have been also exposed?
The specifics of who should and shouldn't be tested is a works in progress. I'm aware of some companies that are requiring that people are tested every 2 days. I'm aware of some like high school sports teams that are testing the kids playing sports weekly. It's a works in progress, and I don't think that we know the answer. If you have come in contact with someone that has COVID, the safe and appropriate thing to do is to sequester yourself for a period of a couple weeks, get a test. If the test is negative and you have no symptoms, after a period of time, you can go back out in the population. Why? It's not to help you, it's to make sure that you don't, by accident, spread it to everyone. I want to remind you of a recent horrible situation where a Santa Claus visited a nursing home and inadvertently infected 67 people and several died. Now, the Santa Claus didn't know that he had COVID-19 until several days later. And so hence the reason that if you think you may be exposed, to take yourself out of the fray so that you don't inadvertently hurt people you love.
Thank you. So we have only about 13 minutes left, all right? I want to hit on some of these questions that are really different than others. And one I just came across is, with the pandemic, with so many people impacted so greatly by this and so many people stuck home, depression is very high. What are some ways to get out of this funk?
That is an excellent question. I have made several YouTube videos on that exact topic, Stuart.
I'm still here.
And
yes.
I think that there's several things that we have to consider. Number one, I think that we have to fight against social isolation. And so, you know, under normal circumstances, I promote going out and being involved in groups and doing things. And right now, you're not allowed to do that. Under normal circumstances, I want you to go to the gym. I want you to be involved in church, et cetera. And right now, you can't do that. And so I think that we have to find other ways to connect. I'll give you an example. A friend of mine I talked to on my drive home from work, he said, "Hey man, I can't talk right now. I'm on a Zoom date." I had never heard of that in my entire life. He was on a Zoom date. And then he texted me later and said it wasn't a very good Zoom date. So I can't wait to hear what that means. I actually was joking and said, "Hey, did you buy Zoom condoms?" So I was just teasing, you know, but my point here is he figured out a way to engage remotely. My mother loves to play a game called Mahjong. And traditionally, she gets together with her girlfriends a couple times a week to play Mahjong. Well, they can't do that right now. So what they did is they found Mahjong online, and they all get together once a week and they play Mahjong online. These are brilliant ways of doing things. A couple other really helpful ideas, I think. Go outside. So just because we can't be around groups of people doesn't mean we can't go outside, and breathing fresh air and seeing the sun is super helpful. We need to be cautious about excessive use of alcohol and recreational drugs right now. It's very easy to sit at home and double your drinking, and so you want to be cautious about that. And we need to make sure not to allow ourselves to skip out on the things that help us. So for example, we don't want to stop our exercise. I can't tell you how many patients this week told me, "Hey, I'm not doing well, I'm fatigued, I feel like I'm not as strong." And then when I said, "What's your exercise routine?" they said, "Oh, I stopped a couple months ago." And so I think that we need to go back to the basics, making sure that you're eating 3 meals a day, making sure that you're drinking plenty of water. These are not dumb things, these are important things. Very, very important to consider mental health right now.
Great, thank you. Robin writes in that she, suffering for people who have severe anxiety, told to put CBD drops under the tongue. I know that CBD for many are not under the tongue, but the one I guess that she is using might be like that. But is it okay to also use CBD in other parts of the body? Will that help to reduce any anxiety?
So whether or not CBD helps you with anxiety is a question that you can answer by taking CBD, right? So you'll find out for yourself how it works. Now, the different ways of ingesting things, there's lots of different ways. So as it relates to CBD, you can do it topically where it's absorbed in the skin. When you place it under the tongue, that's called a tincture. Tincture is an old pharmacology term where you make a solution They put it under the tongue. Now, if you ever look in the mirror, there are giant blood vessels under the tongue, and it quickly absorbs the chemicals into the bloodstream. So it's actually a very effective way of having a quick onset of action, whether that be CBD or THC. It's actually one of my favorite ways of having a fast onset of cannabis without smoking.
Great thing. So Brad writes in just a quick comment for people that are needing something to do. He says to find a hobby, read, start a journal, get involved with other people. I mean, that's all great things. So thank you, Bradford, for bringing that up. All right. All right. I'm trying to go through these. There's just, again, too many. We could sit on the thing here for probably 6 hours and not get through all of these. Okay. So again, let me first apologize. I really shouldn't apologize, but I will say that I'm sorry that if we can't get to all these questions, but like I just said, we could be on here for 6 hours and we would not have enough time to get through all the questions, because then you'd still come up and find a way to ask more questions. All right, so let me try to get to some of these that people had written in previously and see if there's anything I haven't said already. The fear of taking COVID vaccine. There's people that are just afraid to take it. How do we quell their fears from going in there for this? What can you might relate it to?
One way to quell fears is to help them become educated about what vaccines do and don't do. We're not rewriting your DNA. We're not changing who you are. We're leveraging your immune system. And another way to quell fear is to help people understand that through vaccine programs, we've cured and eradicated scourges such as measles, mumps, smallpox. I mean, it's because of vaccines that we've saved millions of lives. Another way to do it is to help them understand the severity of COVID and COVID-19. I'll remind people that 300,000 Americans are dead since March. None of them because of a vaccine, all of them because of COVID. And that's terrifying. And this vaccine appears very safe in the short term. It's been tested on tens of thousands of people. And so that is reassuring. I will take the vaccine. I will give the vaccine to my family, and I encourage you to do the exact same thing.
Perfect. Thank you for that. Here's another great question. Well, two great questions. Probably a lot more than that, but right in front of me. Of course, one person wants to know when you and I are going to do that telemed call.
It's going to be soon. We were supposed to do it the other day, and I completely did a bad job with technology. So Stuart's going to save the day and use this technology. It'll be soon.
Right. So we will easily be able to let everybody know when we are going to do this. We will send out an e-blast to our entire database. That includes all of you, because you are registered with us now. Even if you weren't before, you are now that you are on this program. Okay, so you will know about it. Okay, so on to the next one, and this is very, very interesting. Should you have an immunity test, I guess an antibody test, after your second shot to see if it's worked?
So that is an interesting question, and I don't know the recommendations yet from the CDC, but logically there may be a role. Now, am I planning on getting COVID-19 or COVID antibody tests in everyone? No, I'm not. I can think of certain situations where I would want to do that. For example, if I gave someone a vaccine and the timing of their MS medicine was such that they may have an incomplete response, then I could test the antibodies and see if they've mounted a full response to know if I need to re-immunize them or give them a booster. Presently, I don't plan on getting COVID antibody tests in everybody, but I do probably plan to use it in a targeted fashion for specific situations. That is a great question.
It was. I saw it. I was like, wow, I drew circles around this. Got to get to this one. All right. All right. By the way, I do have to remind everybody again that this is an MS Views and News program. Okay. We have been, since the pandemic began, we started this series called MS Views Now. Okay. And every one of these programs, they've been monthly. This one is twice this month because we had all these questions. And we will be continuing this all through next year for starters. We've already gotten support from everybody that did support this program. And so we have Biogen and Sanofi Genzyme, Genentech, Bristol Myers Squibb, and EMD Serono. And we do need to thank them for being part of this and making sure that you all are getting the best information that you can. We do have different speakers, talking about this, not just Dr. Boster, but, we do hope that you'll come on to all these calls. And beginning in February, just to let you all know, beginning in February, MS Views and News is going to be doing 8 virtual programs per month. 8, okay? That is a lot. Last year, we did 52 programs altogether, with me being on the road all the time, 160 nights on the road, okay? This year, we've done more than that with all these virtual programs. And next year, I mean, if you just add it up, it's an unbelievable amount of programs, okay? So we will be there for you. And that's what I wanted to get in here tonight. It is 8:27. I have time for what? One question? All right. Sorry, it's chilly in South Florida, and I've got the sniffles, okay? Actually, I'm in Central Florida. All right. Let's see, something different here. Let's sing a song for a moment, all right? I got to go back to that the antibody thing. So they were talking about the taking that immunity test to see if it's not working. But if you really did find out that it's not working, can you go for a second round of shots?
So with other vaccines, yes. And logically, yes. Now, will the vaccine be available for boosters? We don't know yet. Just to share, I called my medical supply company for the Boster Center for MS, and I said, hey, I want to purchase 900 vials of the Pfizer vaccine. And the guy on the phone laughed. And I said, no, I'm being serious. And he laughed and he said, you can't buy the vaccine. And I got all mad and said, what do you mean I can't buy the vaccine? He said, no, sir, nobody can buy the vaccine. It's being held by the government and they're releasing it. And so I don't think we know the answer. I hope eventually we get to the point where we can give boosters, because I think that's very, very appropriate. That's what we do with other vaccines. It's probably just a matter of time before we have an adequate supply chain to do that.
Right. And for 30 people that just responded and thanking what I just said about our programs and what we just did, like 30 people, boom, it was all, I thought all these questions were coming in. It was just all these kudos and thanks. So I want to thank you all as well. And before we end, I want to let you all know that all these programs, it's the end of the year. I have to give my thanks to our video producer, Bill. Bill is here with Orlando Production. And, this is it. I mean, this is a production studio that we do these events at. And I could be in the front of the room doing it, or I could be in front of this big LED wall that you see. But for each of our programs, our different supporters are listed on that wall. The name is now at the top of the program here at the top center. You could probably see that as well. But, again, we had a tremendous amount of questions again. Unfortunately, we couldn't go through them all. It is now 8:29. I'm not going to be able to ask another question. I do want to thank Dr. Boster for being here. I want to let you all know that MS Views and News, as well as Dr. Boster, will be monitoring everything that we possibly can about COVID and about multiple sclerosis, okay? We are going to bring it to the front lines. If you are not connected with us on social media, whether it be Facebook, Twitter, or Instagram, I would strongly suggest that you make sure you get onto our pages, because every day we post information, okay? And not only that, but go to our YouTube channel where this program is being recorded. And unlike others where it takes us weeks to get it up onto our YouTube channel, this is going to be on there by tomorrow night. All right, I guarantee it. Well, I shouldn't guarantee it, because you never know what's going to happen. All right, but I'm going to say there is a 90+% chance. Let's go with Pfizer. There's a 95% chance that this is going to get onto our YouTube channel tomorrow night. And if you do not know how to do that, all right, it's just plain and simple. You go to YouTube/MS Views and News. Okay, and again, now we're at 8:30, and I'm going to say goodnight to everybody. And thank you very much, Dr. Boster. And thank you very much to our audience and for everybody that takes part in our programs. I want you all to be as safe as you possibly can and wear the damn mask. It's important, okay? It's important for you, those you live with, and those around you.
Stuart, let me say thank you for the invite, and let me thank MS Views and News for this opportunity. I'll be very honest that it's super fun for me to get to talk to you in this manner. I want to thank all the sponsors for making this possible tonight. I want you guys to check out bosterms.com, our website. Go to our YouTube channel, Aaron Boster MD, where I put out an MS YouTube video every week. You can find me on Twitter at Aaron Boster MD and on Facebook at Aaron Boster MD. Thank you again. God bless, be safe, and wear your damn mask.
Exactly. Thank you much. Be well. Ciao and bye.